we're going to now look at risk management while focusing on safeguarding. So there's a quote there at the bottom left that states risk comes from not knowing what you're doing. And that is Warren Buffett, one of the richest people in this world. And basically, what he's saying is that you need, risk does not operate in a vacuum. You need to have objectives. And from these objectives, then the risks emanate from them. So, with regards to safeguarding, you have to look at what it is you're doing, what activities are you undertaking. Then you employ the risk management or risk management tool, which is the picture on your right. So the first thing is to identify the risks. However, before you identify the risk, you need to know what it is you're doing. So what activity are you doing? That is not included in this because the picture on the right is from a risk management, organizational risk. But under organizational risks, one of the key risks is safeguarding risk, which has of late become quite significant and key for many organizations. So I would ask, for example, for this team, what is your goal? What is your purpose when it comes to whatever it is, whatever goal you're working towards? So, for example, I'll go back to the example of using, of engaging with people with lived experiences, right? So that is your objective, to communicate with them, to get more information with regards to mental health. So from interacting with these people with lived experiences, that being your objective, what risks will emanate from that? So once you identify the risk, the next thing is to analyze. So, for example, under the analysis section, if the people you're talking to are under the age of 18, that means they're children. What are some of the things you need to put in place before you engage with children? Do you have that in place? So, that is what you do under step two. You analyze the risk, then you evaluate or rank the risk. So, if you're talking to children, are you talking to them without a guardian present? Will the guardian be present? So, those are some of the ways you can evaluate. You could also have consent forms that are signed by the guardian. Those are just some of the ways of evaluating or ranking the risk. Then, number four is the risk treatment. And treatment can be in a number of ways. One, you can decide to proceed as is, that is accepting the risk. Number two, you can decide to transfer the risk. So perhaps you decide instead of dealing directly with children, I'll have someone else talk to them, someone who probably is has the mandate of talking to children directly without me being in the room, or like a social worker. So you can decide to do that, and that's transferring the risk, or you can avoid. Although if you avoid completely, then you might not be able to meet your objectives. And then lastly is to monitor and review the risk. So the thing with risk, generally, not just about safeguarding risks, is that they change. So something that is a risk for you now may not be a risk for you in the next maybe 3, 4 months, 6 months, maybe because you have treated the risk, or maybe it's no longer existing. So you have to keep on monitoring and reviewing. In the same breath, some risks can take a higher, I want to say, they can change their rating. So something that you considered was low risk in your period of analysis can end up being a higher risk later. So you need to consistently monitor, review the risks, and apply the proper treatment for you to manage the risk. So you might be asking, why is this important? Why is risk management important under safeguarding? For one, when you're dealing with donors and funders, and in this case, for those who are going to apply for this prize, that will be the Wellcome Trust and APHRC. One of the things we're going to look at is, do do you have safeguarding policies in place? Is there a safeguarding culture in place? Do you manage the safeguarding risks that probably emanate from your work? And how is that dealt with? So that is apart from looking at your technical proposal, apart from looking from your application, these are some of the due diligence assessments that you'll conduct. And it's good for you to have this in place in case you haven't yet. You can start now this time, or you can sensitize your organization even if you're not planning to apply for the prize. This is something you can work towards. Remember, we said that safeguarding is a moral and legal obligation. So, in the long run, it will be beneficial to you and your organization. Things like having a whistleblowing process and reporting systems in place, very key in today's environment, and helping you also be able to assess what kind of safeguarding incidents happen in your organization and with when you're dealing with outsiders as well. So, in summary,